Thank you, Mr. Chairman. Thank you for allowing me to join this committee for the very important hearing. And I want to thank our witnesses today as well. You know, vaccines are a key part of reopening the economy and returning to our normal American lives. Thanks to the Trump administration's Operation Warp Speed, we're able to help bring about successful and effective vaccines to fight COVID-19. It's an incredible achievement for the United States. You know, without Operation Warp Speed, we still would not have vaccine for several years to come. With vaccines and a better understanding of how the virus operates, it's now necessary that we start to work on how do we return to normal. That means getting back to school and getting back to work. And to do this, we have to make sure we get shots to whoever wants them as efficiently as possible. In December, the Trump administration began this process, ensuring that states receive doses of the Moderna and Pfizer vaccines, allowing them to tailor distribution to the needs of their communities. While some governors leveraged existing state distribution channels and funding from the CARES Act, others hampered health officials with unnecessary red tape and political gimmicks. I'm disappointed that my state of Kansas has been slow to distribute vaccines to high-risk Kansans in rural areas. Kansas has been last in the country in getting people vaccinated for several weeks of the vaccine's been available. And further complicating these efforts has been Kansas leadership has struggled to report accurate information to the CDC. Yesterday, the CDC reported that nearly 755,000 doses have been given to the state, with nearly 531,000 doses administered, while the Kansas Department of Health and Environment is reporting that nearly 695,000 doses have been distributed to the state, with only 506,400 doses administered. These numbers are off by tens of thousands, unfortunately. It's clear that many states have to work to improve the distribution process immediately. That starts with better collaboration between agencies involved. I want to urge state, local, and federal officials to work together with others to find solutions and get the job done. Now's not the time to duck that responsibility. Millions of Americans are counting on the transparent and efficient vaccine distribution to see loved ones again, or to worship again in person. I know Americans are ready to get back to work and get back to their lives. It's time that we focus on how we can make that happen. I look forward to working with my colleagues to further protect Americans from the virus and ensure that our nation is prepared to handle future threats to our public health. Dr. Marsh, in the state of Kansas, we've had a great deal of struggle working with the rural counties. And similar to West Virginia, we have a mixture of urban areas as well as rural areas. So the leadership in Kansas has been struggling with balancing the vaccine distribution across all of those counties and keeping up data reporting to the CDC. What suggestions do you have from one state to another to get more shots in people's arms and ensure that we're meeting all reporting requirements?
Thank you, Congressman. I think that is a challenge for many states. For us in West Virginia, as I said, that we have established now a vaccine place in each one of our 55 counties. We have allocated the vaccines based on the percent of that population per county that has our prioritized population, either essential workers over 50 or citizens over 65. And we work to make sure that each allocation of vaccine is utilized completely by the end of the week so that we zero out every week. And because we have pharmacists that manage the vaccines, that we are consistently getting 6 doses of the Pfizer vaccine out, and we're oftentimes getting an extra dose of Moderna as well, which gives us a rate of vaccination over 100% of what we're given allocated. Although now that's changing the way that things are being counted. So I think that having the rigorous and disciplined supply chain so that you track your vaccines, that you're not giving excess amounts of vaccines, that you're giving vaccines to places where you know they can be delivered. But the most important thing, and this has been mentioned before, is this is not about coming up with some number or ranking or some responsibility that is a burden. This is about taking care of your community. This is about saving people's lives. This is about taking care of your neighbors, your family. It's very, very personal in West Virginia. And I think that's the spirit that is helping West Virginia do well, because people are doing this out of love for each other, as opposed to out of a sense of burden for some ranking.
Well, great. Thank you, Dr. Marsh. It is important that we get the vaccines distributed. We don't lose any to waste and make sure that it gets out and distributed across to all the population. With that, I yield back, Mr. Chairman.